So there are several conceptual advantages to liquid biopsies, and I should add that liquid biopsy comes in different flavors, and we are particularly interested in circulating cells, but we are also interested in cell-free DNA, and that is work that we presented here at ASH at this meeting. And the conceptual advantages are first and foremost that it's much more convenient for a patient to get a vial of blood by a phlebotomy compared to bone marrow biopsy. So there's less risk, more convenience for the patients, but we might also get more information than with a bone marrow biopsy alone. Because when you get a bone marrow biopsy, you get it from one particular site in the bone, and that is always associated with sampling bias. And we hope that a liquid biopsy may give you a more representative picture, but certainly a different sampling bias, which hopefully reveals more information than simply a bone marrow biopsy. And another advantage is that you can obviously get a blood draw much more frequently. As a matter of fact, in our patients with multiple myeloma, we get multiple phlebotomies anyway in the course of the therapy, and we can't really get a bone marrow biopsy very frequently. And that frequency allows you to get a picture of clonal evolution of the disease with very high granularity that is not really possible otherwise. And there are other advantages too. For example, the fact that sometimes bone marrow biopsies are a little bit harder to standardize because a bone marrow biopsy can be diluted with blood or it can be not representative of the entire myeloma because the disease is patchy in the bone. And a phlebotomy presumably is much more homogeneous and therefore more reproducible between different phlebotomies.